Hello everyone, and welcome to the second live event of The History Effect, a new online series produced by the History Council of New South Wales. My name is Nancy Cushing, and I am facilitating 4 of the 5 sessions we have this week on the Spanish flu, and I'll be presenting the final one this Friday. Before we begin, I'd like to acknowledge the Gadigal clan of the Eora people, the traditional custodians of the land on which the History Council's offices at the Justice and Police Museum sit, and pay my respects to their elders past and present. 2 years ago, in 2018, historians around the world marked the centenary of the pneumonic influenza pandemic, popularly known as the Spanish flu. In Australia, commemorations continued into 2019, 100 years after the flu took hold here, killing some 15,000 people. As we explored the events of that period, the masks, quarantine, closure of public gathering places, temporary hospitals, and the many deaths, we had no inkling of another pandemic looming just around the corner. Throughout this coronavirus crisis, people have looked back to the Spanish flu to try to see the way forward. Many comparisons have been made, some of them better founded than others. Realizing that this current pandemic does have precedents is in some ways consoling and in others sobering. So in our series of talks this week, we will explore 5 different aspects of the Spanish flu. Tonight, Dr. Peter Hobbins will discuss the community histories written about the pneumonic influenza. Tomorrow night, Dr. Lisa Murray will draw on the rich collections of the City of Sydney archives to show how the City Council acted to control the flu. On Wednesday, Leila Elmos will share some oral histories of the Spanish flu. Thursday night's session is with Dr. Kate Ariotti, who will examine the soldiers' experience of returning to Australia during the pandemic. And finally, on Friday, I'm going to introduce a little-known aspect of the Spanish flu in Australia, a scheme of universal inoculation designed to reduce the deadliness of the disease. So now I'd like to really warmly welcome tonight's speaker, Peter Hobbins. I'm really pleased to have Peter with us as part of this series. As a medical historian with an interest in quarantine, he's become an acknowledged expert on the Spanish flu and has appeared widely in the media over the past 2 months. Later this evening, about half an hour after we wrap up, he'll feature on an episode of Australian Story about the earlier pandemic. But tonight he's going to share his work, the work that he helped to encourage community histories of the Spanish flu. So a very warm welcome, Peter.
Thanks very much, Nancy, and thank you everyone for coming along today. Let me just bring up my slides. Look, I'd like to begin by congratulating the History Council on pulling together this series at very short notice once they became aware of tonight's Australian Story episode, which was a hoot to be involved with. There's been an incredible amount of media interest in the pneumonic influenza or Spanish flu since the COVID-19 outbreak started, really since the beginning of March. And what's been really thrilling to do, working with the media, but particularly tonight, is actually explore the hidden impact of an allegedly forgotten pandemic. And that's really part of what I want to get at tonight. It's been really fascinating for me to be trying to analyse one historical phenomenon in the midst of another one that's emerging all around us. And what I wanted to do tonight was integrate 2 different collaborative community history ventures and encourage you to participate in both of them as we go along. Now, for many of us who grew up in the post-World War II West, 2020 has been an unprecedented year in terms of the restriction on our freedoms and the threat to our livelihoods, as well as to our very existence. Now, that, of course, comes at the expense of thinking about illiberal regimes around the world, where we haven't seen anything like some of the limitations on freedom that other people grow up with, around the world. But it's been a chance instead for our media and for us to look back over a century to find a similar circumstance in Australia. And there's been really, for me, the first time in my career as a historian, a real sense of déjà vu with parallels to my own study of the period around 1918 and 19 in Australia. Now, almost from the beginning, the media latched on to this idea of learning lessons from 1919, and they've tenaciously clung to that story ever since. And although I've sort of answered those questions ad nauseum on many media outlets, what I've been most interested in has been the number of talkback callers who've rung in with stories of their own family experiences. And you can see on the screen here, here's one from a woman who called herself Judith, who rang into James Valentine's program in Sydney just a few hours before the World Health Organization declared COVID-19 a formal pandemic. And you can see here that Judith was incredibly proud of the memory of her grandmother, Beatrice Lake, who was apparently known as the Angel of Petersham in Sydney. And as you may have noticed, Petersham was where I took that photo on the preceding slide. Now, Judith said that, you know, her grandmother did all the sorts of things that we have started to appreciate were essential to maintaining people's livelihoods in 1919. Keeping things clean, paying for groceries, and looking after fellow members of the community. And yet, when I went looking to find any evidence of the Angel of Petersham or Beatrice Lake's contribution in Petersham in 1919, I couldn't find anything, not in the local council records, not in the local mayor's annual report for 1919, and certainly not on Trove in digitised newspapers. So in one sense, it's an apocryphal story. We don't know if it exists. And yet in the other sense, it's a completely typical story. It's exactly the sort of story that has been forgotten in public memory and yet remained in private memories for a century. And for instance, we can see that there are very few public memorials to Spanish flu or pneumonic influenza, as is more widely known in Australia, that have emerged over the last century. And yet if you go to Braidwood, to the Uniting Church there, you'll find that there's this plaque to Kate Burke. Now, Kate, as you can see, was aged 71 years old in 1919. She was a fruiterer who joined the voluntary aid detachments and served the Red Cross through the First World War. And when the war had ended, she'd come back to do emergency service, manning the local hospital set up to deal with pneumonic influenza. Kate, remembering she was 71 years old, was called out to deal with a patient who was very sick with the disease, George Stiles. Now, George's wife begged Kate not to wear a mask when she went in to nurse him because he was terrified it would mean that he was on the verge of dying. So Kate, either bravely or madly or both, went in and nursed him for about 2 hours. Sadly, within a few days, George was dead, his wife was dead, one of their 2 children were dead, and Kate herself also died. So this monument at Braidwood Uniting Church recalls Kate's sacrifice, and yet it doesn't mention what she was doing, and it certainly doesn't mention the disease. And so it's not surprising in some ways that Alfred Crosby, the American historian, famously termed pneumonic influenza or Spanish flu the forgotten pandemic. And other historians locally have also made similar claims. So, for instance, Jeremy Yude in 2017 argued that there were no monuments to pneumonic influenza in Australia because it was such a monumental failure of government and of modern medicine. It wasn't something we'd want to commemorate. My response to that is, what about Gallipoli? In New Zealand, though, in 2018, Nick Wilson and colleagues conducted a survey where they found there were also almost no monuments to Spanish influenza victims or to volunteers there, although interestingly, of the few that they did find, 50% were devoted to women. And I think that's really important. You can see it in the photo here, and you can actually even see it in the duties that community groups were sharing out in 1919. What you can see written on the board there is the list of local nurses who are helping out in the community. And then on the right of that blackboard are all the people who are helping out with the cooking as well. And so really the locus of action at a community level in 1919 very much came down to these fundamentals of welfare and nursing. So I became interested in 2018 in setting up a project to mark the centenary of pneumonic influenza at a community level. Now, I did that through the Royal Australian Historical Society because one of our strategic goals is to promote not only research into Australian history, but actually also to encourage people to share their research in whatever format they're comfortable with. So we use that centenary moment to mobilise and validate community history research. And we set up this project called An Intimate Pandemic, where we mixed a range of elements, including a website, printed materials, in-person presentations where I did what I called a flu roadshow around regional New South Wales, and also through social media. And the fundamental question I asked all the audience throughout this experience was not me wanting anything out of it. It was, what does the flu mean to you? What's the local or family impact of pneumonic influenza 100 years on? What's been remembered and why has it been remembered? And so we encouraged people in country towns like Bathurst, Bega and Bowral, as well as in Sydney and Newcastle, to think about their personal, genealogical and local history resources, particularly outside of the metropolitan areas. And what we encouraged them to do was to come up with snapshot projects that gave us a sense of building a bigger patchwork of the impact of the flu over 1919, at least in New South Wales. Now, one of the reasons that I wanted to set this project up was that in the post-World War I centenary world, I was hoping that we could mobilise community histories around a single dramatic event. And I was particularly keen, as an academic historian at the time, to go beyond just recruiting community members as unpaid research assistants, but rather to treat them as partner practitioners, in a sense, sort of rigorously collaborating with them. And in this, I was inspired by my hero, Tanya Evans, as well as Mike Esbester, who runs a fantastic project on railway life and death in the United Kingdom. And they've collaborated, or they've focused their efforts around this hashtag on Twitter, Historians Collaborate, where they're trying to build genuine partnerships between academic and community historians. One of the things I've been asked a lot by the media over the last couple of months is, why was the pandemic forgotten? And part of my answer is, it wasn't. It was never forgotten. It wasn't publicly commemorated, and we didn't build a series of statues or obelisks like we did to the Anzacs. But part of my argument in response is to say that pneumonic influenza had a local impact right across Australia. In other words, it was part of everybody's life. And in effect, it was forgotten publicly because of its very ubiquity. Everybody knew about it. Everybody remembered it. They didn't need to create monuments to it because the memories of it stayed alive in their own minds and in their family stories. And just to give you a sense of the ubiquity of that impact, you can see here a map that we put up on the Royals website that shows in blue all the sites of outbreaks, and in the orange crosses all the sites where there were deaths recorded across New South Wales. It truly affected almost every community across the state. And what that means is that you can go looking for records of pneumonic influenza's impact in local government, church, school and business records, as well as in actual sites in many of these towns as well. Now, the project itself was made possible through the Alan Martin Award provided by the Australian Historical Association, and I'm grateful to them for giving us that money, which allowed the roadshow to happen. But all the way through, it was a collaborative effort. My first step, both before setting out and also when visiting any of the towns that I went to around New South Wales, was actually to survey local historical resources, talk to the local family and history groups, and try to find accounts and initiatives that documented the impact of the flu during that time. Also, the Royal Australian Historical Society's librarian, Donna Newton, did a fantastic job of collecting many formal and informal accounts that were sent in to us through that period. And also, I have to sing huge praise to the History Council for History Week in 2018, where local historian Chris Meader and local archivist Annabella Silva put on this amazing exhibition at the old Petersham Town Hall for the Inner West Council archives, where they asked members of the community to contribute materials they might have had about the Spanish flu. They brought out a huge range of resources, including council records and other artefacts. And they then set up a series of interpretive displays, as you can see here. Lying on the table is a map of the locality of Marrickville, where a pin was put in for every single infected household that could be identified through 1919. And you should have seen the engagement of people who came in and looked at that map and tried to work out how that mapped onto today's world, but also tried to explain the dense patches as well as the empty patches as well. It may well have just been there were factories there, which is why there were no dots around any households. In addition to that, they also brought out their archives. They brought out local council records and said to people, have a look at these. We're encouraging you to come and use your community records. And that was an incredible inspiration for me when I went out into the wider community. Now, part of our project involved providing a narrative core, an essay outlining the basic impact of pneumonic influenza across New South Wales in 1919, which allowed us to build a slightly bigger picture of the history across the state through the community stories that we encourage people to write in and share. And they could do that through a dedicated part of our website. And as you can see, it was very much front and centre as part of the Intimate Pandemic website. Now, we had a peak of access to the website in 2019, as you might have imagined, and it's still going up at the moment with over 3,000 hits and a 30% bounce rate, which, if you know anything about website statistics, is quite encouraging in terms of the number of people who stick around and have a read rather than just popping in for a few seconds and moving on. Now, what we saw over 2017 to 2020 across New South Wales were at least 30 historical presentations, articles, booklets and websites. And I've seen some of your faces out there today. Hello, Kate Story. I saw your account, for instance, of the impact at Royal North Shore Hospital. So there are plenty of accounts that have addressed aspects of local communities, family memories, and special interest groups as well, whether they're medical or transport or occupational groups as well. So the wonderful thing about all of these histories is they were written by community members for their local community. And when I read through these accounts, you could see there were some really clear unifying threads, particularly the intimate impact of pneumonic influenza upon families and on communities, down to just the street or neighbourhood level. And the other real thread that came through these histories was the bravery of local residents facing a globally catastrophic disease that was highly infectious and potentially very deadly, and the solidarity they showed in supporting each other at a very local level. Now, when I looked into the research that people were doing to craft these histories, I don't think it'll be a surprise for any of us to find that this is where most of them began. They went onto Trove and found a huge number of newspaper articles, particularly local and regional papers. Now, that, of course, is wonderful. Trove is an incredible resource that encourages people to dip into history. And also, I think, in the context of 1919, it has a particular relevance because when the flu got into a community, and you can see this when you actually get into local council records, you can see the local record keeping system breaking down as the local doctors and officers of health and council members either became sick or were overwhelmed just with the sheer caseload. They could no longer keep up with records. But the local reporter would be the one who went down to the hospital, to the council chambers, to the courthouse, to people's homes to work out what was going on and document on a daily basis how many cases there were and the impact on families, including the funerals. So I would say that in 1919 in particular, local newspapers play a really important role in understanding the community. Of course, we've always got to remember that they were local papers written for residents who are often subscribers and advertisers, and that's going to influence the sort of coverage we have. The other problem, of course, with using Trove is that it was often the starting and ending point for a lot of research as well. And just to give you one example of why that might be a problem, is if we look and see at the phrases people use. Now, if you went in and searched Spanish flu or Spanish influenza for newspapers over that period, firstly, I left out 1918 and 19 because they peaked off the graph entirely. But the point is that because the phrase pneumonic influenza was officially mandated by the Commonwealth Government as the phrase for the notifiable disease in Australia, that was the phrase we tended to use, which is unusual worldwide. The second thing is if you look at references in Australian newspapers going up to the start of the Second World War, you see it still had quite a strong afterlife in Australian print culture, really for 2 decades after the war. Now, having said that, I was concerned that Trove was actually drowning out the willingness of community historians to go out and do their own archival research, particularly for collections that aren't online. But on the other hand, community historians do wonderful things that academic historians don't often think to do. For instance, visiting cemeteries and transcribing headstones. And so one example was this wonderful record by Marianne Fowle from the Shoalhaven Family History Society. She didn't just go out and look at 1919. She documented all influenza-related deaths in the Shoalhaven for a whole century, from 1860 to 1960. So that gave me the chance. For instance, she pointed out that she had one of the very few headstones in Australia that I'm aware of that actually mentions pneumonic influenza. But it also allowed us, for instance, to chart in blue the 100-year pattern of influenza deaths in the Shoalhaven region, showing the fairly typical pattern of deaths amongst the very young and the very old, although a surprising peak in the Middle Ages. But also then we could pick out 1919 and show that really the peak of deaths for that year was very much amongst the 20 to 40-year-olds, which was typical around the world, but it was fascinating to see it playing out on a very local community level as well. Now, unlike most countries, even New Zealand, here in Australia, we don't have a single volume history that outlines a key narrative for the impact of pneumonic influenza on Australia. In other words, there's no single story, there's no dominant narrative. Academic historians who've published on the topic have tended to go to archival records and publish particularly the government's response and medical responses. On the other hand, the community histories that I read, particularly over the last couple of years, re-centred the impact of the pneumonic influenza pandemic on the home, both as the focus for its impact, but also as where its memory was maintained as well. And so that leads us to ask, well, what do we make of all of that today? When we read these community histories and think back to the impact at that local level in 1919, what was it about all the measures that we took then that had the greatest effect on Australians getting through that 8-month crisis from January to September 1919? And I would argue that despite the heavy hand of government at the time and the incredible efforts made by medical and nursing staff through the period, the fundamental needs of most of the population at that time were for welfare, food and respite, particularly for parents who had, who were affected by one or both partners coming down with the flu. And that sort of care was organised and delivered at a neighbourhood level. That's where I think it's fascinating to look at the work of community historians, because they foreground the critical aspect of on-the-ground care at the time. And I think really when you read through their accounts, you don't see that many angels or heroes. And you don't even see that many villains coming through in their piece either. The point that they're making was actually that there was a united response at the time, that the community pulled together. And I think that's, again, one of the reasons why we don't see so many monuments, because the burden was shared so equally. And so, in fact, I would argue that both community and family memories of the pneumonic influenza pandemic were the memorials to the pandemic itself. It was actually in memory rather than in monuments we see the most enduring markers. So in 2020, as we congratulate ourselves on social distancing and self-isolating, I think we should be asking, who made that possible? Who allowed us to live so healthily in isolation? And how visible will the people, like the poor Deliveroo drivers or riders who went out in the rain on their battery-powered push bikes to deliver pizzas to us, are we ever going to build a statue to them? Are we going to, for instance, save the Deliveroo app and all the metadata that goes with that and the customer databases and what they ordered to eat when they were staying at home trying to socially distance and self-isolate? So that's why I've been encouraging people on social media to document the COVID-19 pandemic as it's rolling out as well, so that we have a very street-level archive for historians in the future to call back on. So that's me wrapping up really. Look, I'm really grateful for the direct and in-kind support provided by a huge range of collaborators and individuals. It was indubitably a team effort all the way along, both in terms of the inspiration and the collaboration that I enjoyed all the way through. I'd certainly welcome your feedback and any ideas on what I've just presented here, because it's going into a chapter in a book coming out on forgetting and remembering the Spanish flu. And if you pardon the awful pun, I could say that we have barely begun to explore genuinely collaborative histories, but I hope that there's a brighter future ahead for them. And do remember to tune into Australian Story tonight at 8 o'clock and come back here each night this week to hear the rest of this amazing History Council series. Thanks for your attention.
Thank you so much, Peter. That was really great. Sorry about the technical issues along the way. It sounds like from our technical position that we were Zoom bombed then when it dropped out. So that's also something that I think has only just started during the pandemic, or at least we've only become aware of. So yeah, just so much to think about there. And so I'm looking in the comments in the chat for any questions. We've got a comment fairly early on saying this sounds like her story rather than history. the nursing, the welfare, the caring that you're talking about, often falling to women. So do you have any comments on that from a sort of a gender perspective?
Yeah, absolutely. And that was one of the main reasons why, after 4 years of World War I centenaries, where we had a huge emphasis on the diggers, on the men, and also quite a pronounced recognition of women's nursing service during the First World War, I was really keen to look at the pneumonic influenza centenary because it heavily involved women. Now, in terms of casualties of the flu, at least in New South Wales, people who died, roughly 60% were men and 40% were women. But in terms of cases, we certainly didn't see much of a difference. Men tended to have more severe cases, I would argue, for gendered reasons, in the sense that in 1919, they were still primarily the breadwinners. They were primarily still the people who felt that they had to push on. And the medical advice at the time was, as soon as you get sick, don't fight it. Go to bed and just get through the crisis. But it was the men who tended to push on and suffered, unfortunately, with a higher death rate. Having said that, of people who developed a severe case of pneumonic influenza, the death rate amongst men was about 18%. Amongst women, it was about 10%. But if you were a pregnant woman, your chance of dying was nearly 27%. If you hadn't delivered your child, they would almost certainly die or be stillborn. And if they were born, the death rate of neonates was about 30%. So women, I think, in 1919 and afterwards actually bore a huge burden of unrecognised grief for lost children, children lost either pre or post-term. In addition to that, what I've tried to emphasise in every communication I've had about the flu was the prominence of women. And you saw it in the photos that I showed there. You see it coming out in all the community histories that have been published. This was something that was shared equally across the community, and women were very much to the fore, particularly at a time when there were still 165,000 Australian Imperial Force members waiting to come back from overseas.
Yeah, you're quite right. That burden of grief that women were bearing is quite striking about this flu. So we've got another comment here about collecting photos related to COVID-19 and that people are out there in their local communities and taking pictures. And I know Peter's been very active with this and posting them on social media. So they sort of have a double life, don't they, Peter, where they're there on Twitter, but you're also making a larger collection and contributing to the state library's collecting efforts. Is that the idea?
Yeah, and it's been amazing to see how many collecting institutions have been setting up initiatives like this. So most state libraries around Australia have set up some sort of COVID collecting initiative. Sometimes they want physical ephemera, sometimes they want digital ephemera or photos. They've also been encouraging people to write in their memories. So, for instance, Australia Post has said, write us a letter about your experiences of COVID, and it'll end up going into the National Archives of Australia. So there's quite a few of those initiatives out there. The one that I put up on the screen there, COVID Street Archive, is just one hashtag where I've sort of bombed the State Library of New South Wales. I didn't actually ask their permission. I just started tagging them whenever I put one of those pictures up because I wanted them to sit up and take notice. But I just wanted people to capture anything out there. Now, my own photos have focused on signs in shop windows, but I've also been photographing teddy bears in people's front windows, rainbows chalked on the footpath, the little social distancing X's that we've seen put up everywhere. I'd love to have been taking photos of people actually socially distancing over time, because my anecdotal observation is that they bunched up as the months went on. And so we were actually further spread out in the early months than we were later on. So, and I'd so wish now that I'd been taking photos or even talking to all of those home delivery riders, because I think they are a completely forgotten subculture. So few of us will think about them in 10 or 20 years' time.
Yeah, really true. And so, I mean, I guess the nurses and teachers are getting recognition as frontline workers in ways that we hadn't really thought of before. But there are whole other echelons of cleaners and people working in public transportation and delivery people. Maybe one question just to finish off with. Peter, do you think that your experience in researching the topic has prepared you for the next pandemic? And if so, how do you feel about it? So is the questioner asking about the next one after the current one? God.
Yes. I'm wondering, look, I must say when I'm invited to comment on COVID-19, I do remind people that I'm a historian, not a medical practitioner or a public health official. And I also say that, I'm trying to look backwards, not forwards. But having said that, one of the things I've really enjoyed doing is, hopefully, as I showed tonight, come out of stories about 1919 with messages of hope for 2020. Now, there's cautions in there too. I think, we saw very clearly in New South Wales in 1919 the dreaded second wave. We had a peak of cases and deaths in April 1919 because the early draconian regulations had been relaxed. And as a result of that peak, they were reimposed. And then gradually the social and economic pressures to relax them caused some waning. And then we saw a second, even more prominent peak in late June and through July 1919. So we actually had pretty much twice as many deaths in the second peak as we did in the first one. So there are salutary lessons to think about today. Of course, the situation on the ground is somewhat different. But the other thing that I say, and I've been so heartened to see in 2020, is that community spirit of 1919. Of course, we live in very different worlds now. But in terms of thinking about acting responsibly to each other, about supporting each other, about doing our best to obey a whole series of recommendations and rules that have been imposed upon us, even at the cost of our livelihoods and our places of worship, our places of education, has been an enormous social impact. And we've approached it with good humour and good grace and a willingness to think about each other. And so, to me, that spirit can be seen in 1919 and 2020. So in that sense, I was actually really pleasantly prepared for COVID from having seen how the Australian community pulled together in 1919.
That's nice, and that's a really nice and a place to end things on that note of solidarity. So thank you once again. That was really a brilliant talk. I hope it was inspirational for all of the historians that are out there listening and thinking about how they might look into the history of the Spanish flu in their area or the current pandemic and start creating those historical resources that historians in the future will be so grateful to have. So I guess we've plugged enough that we have Lisa Murray speaking same time tomorrow, and also now we'll all toddle off to our TVs and have a look at Australian Story at 8 o'clock. So thanks everyone for joining us for the first in this series, and we hope to see you again tomorrow night. Thank you very much.